retired from Charlotte after 35 years as an OB-GYN in Charlotte and came down here and in the early 2000s. And I was recruited by Katie Close, who was the medical director at the time and the only doctor at the clinic, along with Charlotte Moore, a nurse practitioner. And Katie caught me one afternoon and said, "We need you at the clinic." And I said, "Sure, I'll be glad to come help." And I started out working full time every day. Then I realized I was in retirement. I was not supposed to work that much. But at any rate, I've been doing it now for off and on about 12 years, 10 years in a row. But I did it a little bit in the early 2000s and then went back to Charlotte after I had semi-retired and worked again for a while. And then I came back in 2008. I love what we do, and I love why we do it. I like being able to say when I examine a patient that her exam is normal instead of having to go through pages and pages of negatives. So it's very easy and laid back atmosphere and certainly easy hours, and I appreciate the patients because they appreciate what we do for them. Well, I've hit up all my friends, doctors in particular, to come and work at the Smith Clinic. I never meet a doctor that I don't ask them if they'd like to come work at the clinic, and can tell you that I've recruited most of the doctors we have here as friends of mine, and I think they're still friends. But and Patient Partners has been a wonderful program over the last few years where people can contribute and help pay for patients' care for a whole year, for instance, with their simple donation. Fortunately, we live in a nice enough community that I've got lots of friends who have participated in our Patient Partner program, and I appreciate them very much for that. Because we see patients who can't get care anyplace else. They don't qualify for Medicare or Medicaid, which is unfortunate because all of our patients should qualify for Medicaid by most standards, but unfortunately in most states they don't. So there are thousands of people out there who don't have insurance and don't know how to get care, and we have been able over the years to grow, because when I first started coming here we'd see 2 or 3 patients a day and that would be it. But now we're seeing a lot more than that, and we fulfill a definite need, and the word is out more and more every year in the community that we're here for them. And they can't believe it when I tell them we can get a mammogram or a pap smear for them for free, or that we can treat them for something abnormal for free. Well, it says that we have a very giving community. The people in this community are very much into the business of caring for charitable causes. I never have a day go by that I don't get something in the mail soliciting funds for some local charity. And Smith Clinic has been run beautifully by our executive director, Ann Fall, and I give her tremendous amounts of credit for all that she's done since she's been here and building this clinic into something that most people know about. In the old days, we would run into people who had never heard of the Smith Clinic. They'd say, "You what? You can get free medical care?"